I'm going to take these gloves off now. And then I'm going to put these on. You guys have done this before, right? Okay. And then now my hands will be sterile. Okay, so I don't need this. Garbage. Chuck it away. But now my hands are sterile, so I can touch anything in this kit. Can I touch this book? Can I touch this water? Can I touch myself? Can I touch the table? No, but I can touch anything in this kit. So I can rearrange it, I can open it up, I can show you all the cool stuff that's inside. So inside the kit, what you're gonna find is a few things. So one, this is a drape, and I'm gonna do it again over by the patient so you can see. But this basically is a window that you place over the patient's urethra. So the vagina or the penis would be sticking out this hole so that everything around it is kind of covered up except for the part that you need. This will go underneath on the ground, on the table, underneath their bottom, basically laying down like this. Okay, and we're gonna go over this again. I just wanna show you what the different things are that's inside this kit. Okay, no, I cannot put it here and put it back in here, but we're going over. So, this is the catheter itself. So it comes all connected like this. This looks like this. This is the bag that's going to collect the urine. It's collected by gravity, which means that the bag must always be lower than the bed. Because if the bag is higher, then the gravity is not going to work and it's not going to come out to the urethra. So the bag always needs to be lower than the urethra, which means usually lower than the bed. This is the catheter itself. It's covered in this plastic wrap to give you an extra protection. I like to keep it in this until almost the last minute because it's kind of hard to take out and then it wobbles around, and if it touches something, this is the part that's most important that stays there. This so you just see what the Foley catheter looks like. So at the tip of it is a balloon. I'll show you what it looks like. So once you put this in, you might be thinking like, well, how do I keep it in there? Because it could just slide right back out. So once you put it in, there's a port right here that you connect this. Oh, there's a camera. Connect this to, like this. This would be already inside of the patient. And you fill up this, I'll pick it up so you guys can see it. But this balloon will fill up with water once it's inside, because it's in the bladder. So it goes through the urethra, which is a small, narrow canal. Then it gets inside of the bladder, which is much bigger. And this fills up in the bladder and acts like a lock.
So do they feel it when you blow that up?
Do they feel it? I've never asked anyone if they can feel it. I mean, usually they're just kind of shocked that something they can feel it going in. Definitely. I'm not sure about the balloon itself, but it doesn't hurt. What would hurt is if
I had
they
my
tried to pull it
epidural, I
out.
didn't feel anything.
Because the urethra is only about as wide as this whole Foley is, right? Because the Foley can fit its way through, but this can't fit back out. And that's the whole point of it, is to lock. So when you go to take it out, you have to take the fluid back out. So you do it the same way. You put when you're going to remove the catheter, you put this back on here. Oops. And then you slowly pull back all the water, and your catheter will
When I had my
be able to
epidural,
slide back out.
I felt
Now-
them pulling it out. I never felt them putting it in.
For when now people can still pull it out even with the balloon on. It's very painful. People do it, maybe not in their right mind, but they do it. So just so you know, it doesn't stop you, but it gives you a little extra luck, right? So because it can't slide through. So that's the point of this syringe. Also in the kit, you will find lubricant here, which when we do this with the mannequins, we don't actually open any of the lubricant and put any lubricant onto the mannequin itself, just because we don't need it and we don't want to make it messy and dirty. So this is the lubricant that you would, if this was a real human, you would put the catheter into to make it easier to glide in. Okay, that's what this is. This is to collect a urine sample if you need it. You can collect it actually straight from here. You could actually use a different syringe to collect it from this port right here. So just,
How do you know you're in the bladder?
how do I know?
That was a
Oh,
good question.
good question. Okay,
That was a
so
good question.
we're gonna get there. But the question is, how do you know? Well, once you get this into the bladder, urine will come out. So if you're not into the bladder, there will be no, I'm assuming there's urine in there, but everyone always has a little bit of urine in their bladder. Your body's constantly making it. So if you're going through and you're like, man, am I still not in the urethra? I mean, how long is this urethra? And then you get there and then all of a sudden you see yellow come out, you're in the bladder. Then you usually go a little bit further just to make sure that like you're not just, because the hole is at the very tip. So like you could get urine and you'd only be here. So then you push it in like another 1 to 2 inches, because it won't, at some point it'll just stop going. You push it in another 1 to 2 inches just to make sure you're all the way in, but there should still be urine coming out, and then you blow up the balloon. That's a really good question. That gets tricky with female anatomy because women have 2 holes. They have a vagina and a urethra. Vagina is where babies come from, and a urethra is where urine comes from. They're not the same hole. And so we'll look at that on this mannequin over there that has female genitalia. Men, it's way easier. They've got 1 hole, you can't miss it. Women, it's not uncommon to miss the hole that you want and put it in the wrong hole. So if you ended up in the vagina on accident and you're like, God, I've put this in like so far and there's no urine coming out, that's when I'd be like, all right, let me reassess here. Let me look at my anatomy. Am I actually in the vagina? Because you're not going to get any urine out of the vagina, so this bag would still be empty. In which case, what we do, which I've read mixed reviews in your book, but I disagree. What we do is if you get it in the vagina, you leave it there. Because now you know not to aim for that hole, aim for the other hole. And then eventually you take it back out. But like, if you get this in the vagina, you're like, oh crap. You're going to have to go get a new kit anyway, because you can't just take it out of the vagina and put it into your urethra. Your vagina is not sterile, okay? But the urethra is. So you can't just take it out and reuse it. You'd have to go get a whole new kit anyway. So what we say is leave it in the vagina, go get another kit, and then you know, like, all right, well, that's clearly the wrong hole, so now I'm going to aim for the right one. And then you should hopefully get it in the right hole, and then you take the other one out. So that's a really good question. If you still don't get urine, I'm not really sure where we go from there. If you're like, no, you're in the right hole, you'd want to make sure that the patient, like, it's not, sometimes if it gets kinked in a weird way, you maybe want to move it a little bit, maybe even ask the patient to move their body a little bit, like if they're laying in some manner, if they can move, to make sure. But that's how you know, is by urine return. These little plier type things and cotton balls are for cleaning the area before you insert the Foley. And so what they usually come with is, this comes with a packet of iodine. We don't use this on the experiment, but I would open up the iodine, pour it on top of those cotton balls, and then I would use 1 swab to clean. And we're gonna go over this again, but just so you know what's in this kit. Sometimes instead of these, they look like cotton swabs that are already soaked in fluid. So then you just take one of the cotton swabs, like on a stick, like the kind that you use for like a neuro exam. You would just take that out and then just swipe it and pour it away. It's already basically soaked for you, one less step. So I'm gonna put this together again, and then let's go walk over towards the mannequin, and then we'll go through it step by step so you can actually see it. So this mannequin is a female. If you can put a catheter into a female, you will have no problem putting one into a male. So I'm not going to really go over putting it into a male for you. The steps are the same, just the anatomy is different, and male anatomy is 100 times easier. So that's why I want you to master the female anatomy first, and then the male, you'll have no problem with the male anatomy. Put this away. Okay. I am not going to throw these away. Okay. Okay, so this is not nearly as neat as it was. Okay, let's walk it through steps. So take extra gloves and catheter. I got my extra gloves, and you should always have an extra catheter because, like I said, you get it in the wrong hole, you drop it, it becomes unsterile. Provide good lighting. All right, we're good. Work on the side of your handedness. I'm right-handed, so I'm going to work on the right-hand side. This will make sense to you later once I walk through the steps. But if you're a lefty, stand on the left-hand side of the patient. If you're a righty, stand on the right-hand side of the patient. Okay. Assist them to a dorsal recumbent or a Sims position. So laying like this is fine, but with their knees up, or they can be laying in the Sims position, which is on their side, depending if they can't lay on their back. Oh, well, maybe this anatomy's not going to work. So you want their knees up like this. And again, you're going to be talking to the patient, explaining to them what you're doing before you put them into this kind of vulnerable situation that most people don't feel very comfortable in. Putting gloves on. Okay. So, I just want to make sure I hit all the points that are here. If the patient is confused, ensure safety. I always suggest having a second set of hands with you when you're putting in catheters, especially when you're new, because if the patient's confused and they start being combative, or if you're like, you know, midway through this and you're like, oh shoot, I forgot something, then you have another person there to be like, hey, can you go grab this for me? Instead of you having to clean everything up, go get what you need and come back and redo it. So I always suggest just having a second set of hands with you until you've like really mastered this and you've been doing this for years and you can do it with your eyes closed. Provide warmth and privacy, so like keeping them covered up as much as you possibly can. Drape the patient appropriately. And then peri-care, so you would use a washcloth with soap and water to just clean. You guys have done peri-care in clinical? Okay, and wash the area with just soap and water and washcloth. While washing, look for the urinary opening. So again, in a male and a penis, much easier to find. In a female, let's go over anatomy. So females have 2 holes. Okay, the top one is your urethra, that's where urine comes out of. The bottom one, which is a bigger hole, because where babies come from. So they have to dilate for 10 centimeters before you give birth. And then at the back is the anus. So you can see on the mannequin, it's very easy to see 2 holes. On a real human, not so easy, not easy, okay? This is not an easy area to get a good view of in general. So it's very easy to mix holes up and to end up in the vagina, especially if you're new by doing this. So, but just so you know, the urethra is on top and the vagina is on the bottom. Okay, so we've located, all right, we're good. While I was doing peri-care with my gloves on. So I would always have a trash can here. I see I have one over there, so we're good. Otherwise, ideally, I'd probably have it underneath me on my feet here. So now I did my peri-care, so I would take these gloves off because they're dirty, and I would put new clean gloves on. Not sterile, but just clean ones. I'm not going to waste more gloves because I've wasted a lot already, but these are new gloves after I've done my peri-care. So what I'm going to do is, okay, so I'm going to prepare my sterile field. Now, depending what book you read, or who teaches you, some people say to put it on a table. I disagree, because if it's on the table on my side, I'm going to have to turn around like this. And we just learned that one of the rules of aseptic technique is you cannot turn around from your field. So what I do, and what I was taught, and what many people still do, is you make your sterile field in the bed, assuming that the patient's in a bed. So I would take my kit from the bag. It would be much nicer folded than this, because it would be brand new, and I'd put it down here. So what I'm going to do is open it carefully. So remember, I can't have it touching all the sheets or anything like that, okay? But I can touch the edges of it. Okay, so now we're open. I don't want to touch it to his or her skin if I can help it. All right. Okay, so now we're open and we're good. Okay, so I'm going to take these gloves off and I'm going to put my sterile gloves on. So I can just grab it like this. Now I can be over here and do it over here and put my sterile gloves. I can still use this table, but I don't have my field on the table. I'm not going to really put these on if that's okay with you guys, because I don't want to waste them. So, okay, pretend I have my sterile gloves on. So now I'm sterile. So I cannot touch anything except for what I want to touch that's sterile. So I'm going to open these up. So this is that window that I was talking to you about that you can place. You don't have to use it. Some people like it. Other people don't like using it, but it kind of drapes like this so that you're keeping everything else around there kind of blocking it off, so you have a window of exactly where you're looking. This, okay, is what you can use. Now remember, this is still sterile, so I can pick this up, move it over. This kind of can be used as like an in-between, because as you can see, this field doesn't go all the way up to their bottom. So I can lay this down and slide it over like this. Okay, and as long as just the bottom side is on there, we're good. Okay, so now I have like an elongated sterile. Now my hands are sterile, so I can move all this around to get it into a situation that I'm comfortable with. So what I would do first is take this, I would spray it all over there so this becomes nice brown color. That goes in the garbage. I don't need it anymore. I open up my lubricant. If I can get it out of the little thing. I would put it into, I'd squirt some in here and throw it away. Okay, now what I would do next is, I want to make sure I'm doing it by the book so I don't screw up. This is just how I do it. Organize equipment for sterile insertion, ensure the intact catheter, using the equipment, clean the urinary meatus. Okay, So I'm getting myself all ready here. So what I'm gonna do is take this out. You're gonna look to make sure that everything looks okay. This goes in the garbage. You look over here to make sure that there's no noticeable holes in it. You do not need to inflate the balloon any. There used to be, like 5 or 10 years ago, they tell you to inflate the balloon to make sure that it didn't have a hole in it. We no longer do that. But you wanna look at it to make sure you don't see any weird pieces of plastic that, you know, would get stuck or broken or anything like that, okay? So we're good. I'm gonna place it into the lubricant and just let it sit in the lubricant. Now this is the tricky part, because as you see, it doesn't like to sit still. If there was really lubricant in there, I'd kind of help it be a little stickier in there. Then what I do is I take this, and I'm gonna, that wood shouldn't be in there if it's new, but I'm gonna attach it to here and have it ready already, because it's, you'll see why. It's once you put that catheter in, you only have one hand to work with, and it's very hard to attach that with one hand. So I have it ready. It's attached. We're good. So once I'm ready, you are gonna eventually only have one working hand. So I'm right-handed, which is why I'm on the right-hand side. So with my left hand, I am going to open up to be able to see the labia, to be able to see the urinary meatus, which is this hole right here, to get into the urethra. Now that my hand is here, is it sterile anymore?
Mhm.
Can I use it? Can I touch anything with it? No. So now I'm down to one hand. That is why I already attached this here, because otherwise I'd be doing this all one-handed. It'd be really hard to open my lubricant and squirt it in. It'd be really hard to attach this with one hand and be able to move it. So I'm down to one hand, and the reason I'm on the right-hand side is my left hand can hold the urinary meatus open while my right hand is over here working. If I was left-handed and I'm going like this, would be impossible. You see how this wouldn't work, right? So you need to be on the right-hand side if you're right-handed and the left hand if you're left-handed. So I'm stuck like this. This left hand is not moving. So using my right hand, these would be covered in the iodine solution, or betadine, whatever it is. And you're gonna do one swipe at a time. So I'm gonna start in the middle, swipe, garbage. All right, this one on the other side, swipe, garbage. This one, swipe, garbage. You would do it until they're all gone. And you don't clean like this, it's just one swipe and then you're done. Okay, and you do it until they're all clean. Okay, good? We're all clean. So now I'm going to take the catheter and I'm going to tell the patient, okay, you're going to feel a little bit of pressure right towards your vagina, even though it's not their vagina, but most people don't know where their urethra or urinary meatus is. So I'm going to place this into the hole here, and I'm going to just, well, it doesn't push really because there's very little lubricant in the mannequin. But I'm going to push it in. Oh, wonderful, look, there's yellow urine coming through. Great, yay, I'm in the right hole. So I'm going to push it in a little bit further just to make sure that I'm all the way into the bladder. Okay, good. Now I'm going to inflate this. So my balloon should inflate, all the water should go in. Alright, and now I can disconnect this. Done. Now it's no longer considered a sterile procedure because we touch this all the time without sterile gloves once it's on. So what you would do is you would attach this to the patient's leg. There's these special bands because, as you can see, even though there's a balloon in there, it still kind of wobbles around. So there's these bands that attach it to the patient's leg so that it doesn't get caught on anything. And then this bag would get attached to the bed or be hanging below, remember below the blood.
That paper with the hole in it, does it tear easily?
This one?
Yeah, or do
Yes.
you got it? Okay, good.
Yeah, I would tear it around it.
Okay.
Everything else now is just garbage. I'm done.
Alright.
I put the catheter in. We no longer have to be sterile. I mean, yes, this should be a clean process when you clean this, but it's no longer considered sterile. But as you can see, this is why an infection risk is really high because if this gets dirty with, say, the person has a bowel movement and this gets dirty, it can end up in the urethra if we do not clean it well. So that's why we don't use catheters unless we need them, and we keep them we try and keep them as clean as we can. But this is not considered sterile anymore. So that's putting it in. Does that make sense? Questions on that?
About how many inches did you go in? About 4 or 5?
Oh, I didn't count.
Okay.
Every person's different depending on their anatomy
Okay.
and their height and size. But you would just go in until you got urine. And for men, you actually go in further because you have to get through the penis and then into the bladder. And then go until you have urine and then go in about another inch or so, just to be certain that you're in the bladder. So now to take it out, you know, like a week goes by, she no longer needs her catheter. Great, good news, we're gonna come take your catheter out. Okay, so is this considered sterile? No, because we're coming out, exactly. So what I'm gonna do is just, you wouldn't even have this kit out, but I'm going to take my syringe, attach it, it'll actually kind of deflate itself because of the pressure of the ball. Make sure catheter removal, identify, wash hands, gloves, remove the anchor, deflate the balloon, so we're coming out. Make sure you remove all 10 mLs of water. So by standard rule, all Foleys are 10 mLs because then it's just easy for everyone to know that that's how much should go in. So therefore, that's how much should come out. This way, I say, oh, Leah put this in, but then a week later, Nicole takes it out. She doesn't have to be like, oh, well, how much did she put in? Did she put in 6? Like, how much water should I be waiting for? It's just kind of standard rule. Everybody gets 10 mLs. So that no matter who puts it in and out, you know what you should be getting. So you should keep going until you get all your 10 mLs. Might give it a little help. Did so many times. Okay, great. Okay, so now my recommendation is I would use, can I hand you that towel over there? Thank you. So when I take the catheter out, I like to have a towel here because as you pull, you can imagine there's going to be some urine that's going to come with it. So you're going to just gently pull the catheter out, and you're just going to kind of catch it with this towel because it will kind of dribble and leak and just kind of get messy. And so then you can just kind of wrap it up. This all gets thrown away into the garbage. Towel just gets cleaned. Wipe up the patient, clean them up. Done. Out is much easier. And it's not sterile. The in's the hard part. So this is going to be hard to practice because obviously you don't have Foley catheters at home, nor do you have willing patients who are going to let you do this. So I suggest reading through it. I suggest coming to a lab and being able to practice. Most of the mannequins have anatomy that you can do it on, whether it's male or female. There are also, if you ask the lab instructors, like standalone vaginas and penises. I don't know how to explain it, but it's like just this mannequin of genitalia. So you could just practice putting it on that. You don't have the whole human with you or attached to it, but you just have the genitalia. So you guys can practice. And there are kits you can use. You can reuse kits, so like when you practice again and reuse them. On the day that you check off, we are trying to give you unused kits so that it'll be nice and fresh, if that makes sense. Right now, I only have 3 secured for you guys, and there's more 3 than 3 of you, so it might be a gently used kit that like somebody else in your class used once and then used, but it won't be like this one that I've already made a mess of. That's the goal. I think we're having shortages this year, thank you to COVID, so. But obviously in real life, you always have a fresh, nice kit. Okay, let me put this all away.
For the most part, it's pretty self-explanatory.
Yeah, it's just knowing the steps, and like it's kind of weird when you're doing it. It's different than the reading it than actually doing it. I feel like so that's why I really, really, really encourage you coming to the lab and practicing because this is not something you even if you memorized it step by step. You have to remember, like, to stand on the right-hand side, because if you stand on the left hand, like, that'll mess your whole thing up, right? Or just the whole concept of once your left hand, or right hand if you're standing on that side, once your hand is here, you cannot move it. You'd be surprised. That's one of the things I think students struggle with the most is they're like, oh, I forgot this. And I'm like, that, put it back. Once it's there, it doesn't move. It's stuck. And I just think of it that way. Like, my hand is stuck here until that catheter is in and holding everything together.
So when you're at that step and you get the cotton swabs and you're dipping them, you can do that with your right hand and still keep everything sterile?
Yep,
Oh.
because I'm not actually touching anything except for,
The cotton swab.
I'm not touching the tongs, I'm touching the tongs that are.
Oh, you got tongs. Okay. See, I missed that part.
I wasn't told the tongs. That was
Tweezers? I don't know.
I don't know
Close.
what
I
they're
know what
called.
you mean, though.
These things.
Yes.
These things that you grab them with. I'm not a surgical person, so
Hey,
there's
tongs-
probably a very fancy
tongs
surgical
works.
word for them.
Tongs,
works,
tweezers,
but that just makes me think of like food.
grabbers.
That's probably not the appropriate use of it. So yes, some you would use these instead of using your fingers. The other ones, I don't have them, but they look like they're on like a stick.
Yeah.
Like
They're like
this-
little sponges, huh?
Yes, and it's on a long stick.
I
So
mean,
you
you
would
like
just
pop them almost like you push pressure. Cause when I worked at Aurora for phlebotomy, we had to sometimes get like to see if there's like any like for infections.
Oh yeah.
We would have like these sticks that would have iodine in it a little
Yep,
bit and just
yep,
pop them.
exactly.
And then it goes up to the
Yep.
brush and just.
Yep, and
That's
so they're on like a
cool.
long stick.
Yeah.
So this way you're not actually touching this with your hands to the patient.
Mm.
There's a stick at the end of it, so you're touching that.
Right. Okay.
And it's just one swipe each. So. But I want you guys to be able to like at least familiarize yourself with the kits, because
Okay.
again, that's not something you'll have at home. There are a lot of YouTube videos you can watch, but
Right.
please check what they're saying versus what your book says, because like, it's not outdated, but